Far too many people in British Columbia have died from toxic drug poisoning, and many listening have lost loved ones in recent days, weeks, months over this particularly hard last year. I extend my condolences on behalf of the province and the Premier to everybody who's missing a family member or a friend. British Columbia is in the 6th year of the overdose emergency with more than 7,000 lives lost. It is tragic and it is unacceptable. And for people working on the front lines of this crisis, who have been working so hard to save lives, this is particularly hard to accept, that the pandemic has represented such a setback in that work. That we are still losing lives is unacceptable. I also recognize that many working on the front lines have themselves lost friends and peers. For people who use drugs or care about someone who does, keeping safe in this public health emergency is front of mind. So our government is delivering new and innovative solutions that work together to help people stay safe and to access the supports that they need and deserve. That's why today we are expanding prescribed safe supply in British Columbia to separate people who use drugs from the increasingly toxic illicit drug supply. This builds on the work that we've been doing over the past year. At the start of the pandemic, we provided access to some prescribed safer supply to separate people from the increasingly toxic illicit drug supply. Thousands of people took this up. But we've heard from people who use drugs and from medical professionals that more options and expanded access to safer supply are needed. Today's new policy builds on what we learned during the pandemic and includes input from many partners and stakeholders, including people with lived and living experience, doctors, nurses, pharmacists, health authorities, and Indigenous-led organizations. This new policy will help to separate more people from the poison supply, to connect them to ongoing health care and support, and to stabilize their lives. We are investing $22.6 million arising from this April's budget for the next 3 years, directed to health authorities to implement this expanded policy on prescribed safe supply. These funds will support planning, phased implementation, monitoring, and evaluation of prescribed safer supply products. This means that once fully implemented, more people who use illicit drugs can be prescribed a broader range of safer alternatives covered by pharmacare, including a range of opioids and stimulants as determined by each program and prescriber. This new policy was developed within the limits of the Federal Controlled Drugs and Substances Act, which requires controlled substances to be provided by prescription. BC is leading the country as the first province to offer prescribed safe supply. And we have had to introduce prescribed safe supply carefully, responding to the urgent need for solutions and supporting patient safety and prescribers at every step of the way. During the first phase of this expansion, prescribed safer supply will be available in existing health authority-funded programs that currently offer substance use services, through newly created programs such as service hubs and outreach teams supported through Budget 2021, and through existing federally funded SAFER programs. This expansion work is already underway with every health authority in BC. We have built in rigorous monitoring and evaluation to ensure that we're on the right path, and further phases will expand access once that clinical guidance is developed based on this evaluation. Everyone's working as quickly as we can to implement existing safe supply programs and to build further capacity as we bring more prescribers on board and get new programs online. I thank the courageous doctors and nurse practitioners who work tirelessly to prescribe safe supply, that do this work already, and who back this policy, this new policy that will help more people in British Columbia get the care and the support that they deserve. This kind of change only can happen through a groundswell of collaboration, and I thank everyone who's contributed to this work to date and has worked over this past year with our ministry's Overdose Emergency Response Centre to get this policy moving. We know there is more work to do. There is no silver bullet to end the overdose crisis, and prescribed safer supply is one tool within a comprehensive set of health interventions to help keep people safe and access the support they need, the supports that they need, including treatment and recovery. Just as there are many paths into addiction, there are many paths out, and so we are working hard to offer people options. As we continue to grapple with the overdose emergency, I'm thankful for the good work being done on the ground, saving lives every day. Because of this good work and the many life-saving interventions brought in since 2016, modeling says that over 6,000 lives have been saved. This new policy will help save more lives. With that, I introduce BC's Provincial Health Officer, Dr. Bonnie Henry, to add some remarks. Thank you.
Thank you very much, and good afternoon. As we are in the tragic 6th year of the toxic drug overdose crisis, public health emergency here in British Columbia, and as the Minister has indicated, since then, more than 7,000 people in British Columbia, our friends, our family, our community members, have lost their lives to a poisoned drug supply. And for every life cut tragically short, there are countless more lives that have been changed forever. Our parents, grandparents, children, friends, spouses, and community members left behind, mourning the loss of a loved one, and no more so tragically than in this past year and a half, where we've not been able to come together to support each other. This is a tragedy for all of us as British Columbians, and my thoughts are with everyone who has lost somebody they love to this crisis as well. As we have grappled with the overdose emergency, we have learned and continue to learn the many steps we can take to address the harms. Steps like overdose prevention sites, supervised consumption sites, the take-home naloxone program, which has saved lives across this province, and increasing the number of youth and adult treatment beds have all made a difference, and in many cases, saved lives. But since the onset of COVID-19, the already toxic drug supply has become even more dangerous, and we have seen that in all parts of BC over this past 18 months. And measures we needed to take to respond to this pandemic have led to a record number of our family, our community members' lives lost to this toxic drug supply. And while we continue to reduce the risk of COVID-19 from our collective actions across the province, the risks from this highly toxic illicit drugs remains greater than ever. This is why this is so important to expand the access to prescribed safer supply, to separate people from this toxic drug supply that we know is there now, every day, to offer medications and connect people with the supports that they need to ongoing health care and other needs. Expanding access to safer supply is a vital step that also helps us reduce stigma around people who use drugs and better support people who need this help. A little over 2 years ago, I provided guidance on how we could do this together in British Columbia, ensuring that as we expand access in a way that protects people who use drugs and prescribers, and that we learn as we go, including making sure that we have independent evaluation to put the evidence together to continue to do the best possible programs that we can. We also know that this toxic drug supply is putting people who use drugs at extremely high risk for overdose, for the complications of that, and for death. So expanding access to safer supply will save lives. And also importantly, we have learned that with addiction, connection is so important. And this is another mechanism that we can connect people to other parts of the service of the healthcare system or housing or even getting a meal for a day, things that can make a difference in the chaos that many people's lives are and help them reach that point where things like treatment may be an option. It means now that this access, expanded access, means people who use drugs in all settings will have access to an alternative to the toxic street drug supply. There is no one single measure that is going to get us out of the toxic drug crises, but this is one more step in the right direction. Prescribed safer supply is another important tool in our toolbox that will help keep people safe and help them access the supports they need. We have said all along, it is not about harm reduction only, it's not about treatment only, it's about building up the full continuum of the tools that we need to make a difference for people's lives. Substance use, as we know well, is a health condition and must be approached from a holistic health perspective. And I will continue to call on federal, provincial, and municipal governments to ensure our public health care and community supports reflect an understanding of that reality. And this includes, of course, the work that we're doing on removing stigma through things like decriminalization of people who use drugs. The COVID-19 pandemic has shown us as a community what is possible when we come together to support one another through a crisis. And thanks to the support of doctors, nurse practitioners who have worked through this pandemic to deliver safer supply during the emergency, as well as the efforts of countless others who are supporting people at risk of overdose death. We are making progress, but it is never fast enough or enough. With the toxic drug emergency still before us, I call on everyone in BC to keep responding with the same kindness and compassion that we have shown each other throughout this entire pandemic, and make sure that we can continue to support our loved ones and we move through this next phase. Thank you very much, and I'd now like to introduce Dr. Shannon McDonald, the Chief Medical Officer of the First Nations Health Authority.
Thank you, Dr. Henry. Minister Malcolmson. I want to acknowledge the Lekwungen-speaking people of the territory of the Esquimalt and the Songhees and all of the nations who First Nations Health Authority serves. This is a story about all of us. I also acknowledge Dr. CHOW and look forward to his words. I wish we didn't have to be here today. I wish that the work we did 5 years ago, 6 years ago, was enough, but it's not. I want to acknowledge the losses, the sons and daughters, mothers, fathers, brothers, sisters, friends, leaders, elders who have lost their lives to this toxic drug supply despite all the work that's been done. And given the significant impact of illicit and toxic drugs on BC First Nations, the FNHA is supportive of new and innovative approaches aimed at reducing overdose events and deaths due to toxic drugs. And the FNHA commends the BC government for the work to date on this new initiative and other work that we've done together over time, and for seeking the First Nations Health Authority's input. Implementation of the BC government's prescribed safer supply provides important tools to help reduce toxic drug overdose death among First Nations people who continue to be overrepresented as compared to the rest of the population. While a safer supply will decrease the chances of overdose due to unknown factors experienced in the illicit supply, there are some potential challenges related to the rollout of this program that ensure that it fulfills the cultural, health and wellness needs of First Nations, and especially for those who use drugs. While prescriber-safe supply will be beneficial for many in some specific populations and potentially in some specific geographies initially, it will form an important connection between primary care workers and people who are using drugs. We know that there continues to be barriers for Indigenous people based on differential access, mistrust, and racism experienced in the healthcare system, and to the lack of connection with primary care services in general. So the work of our partnership continues. The Prescriber Safe Supply Program is asking regional health authorities, agencies, and healthcare providers to work to create guidelines for the administration of the program. For First Nations people, there is a risk of inconsistency in approach across the province and among individual communities with potentially variant outcomes. We are spread thin as First Nations Health Authority, and all of those tables require our presence and our input. And I'm hoping that there will be some patience that allows us to do that. We need to continue the conversation, providing education and support to our healthcare professionals who may need to be a little more comfortable with taking on this task associated with providing safer medical-grade alternatives to street-level illicit toxic drugs. We don't want to limit the number of care providers who choose to participate in the program, so we want to make sure that all of the services in education, training, and support are available to them. The FNHA looks forward to working closely with the provincial government, with our partners at the PHO, health professionals, and local communities to ensure that this new program meets the needs of First Nations and that there is a successful engagement process to make that happen. Thank you. And I am honored to introduce the President of the Doctors of BC, Dr. Matthew CHOW.
Good afternoon, everyone. I'm pleased to join you today from the traditional territories of the Siksika, Kainai, and Piikani First Nations, the Tsuut'ina First Nation, the Stoney Nakoda First Nations, and the Métis Nation Region Number 3. BC doctors look forward to increased actions aimed to reduce the harm from illicit drugs that are killing so many British Columbians. I speak from my personal experience of losing patients and mourning with families. I'm a child and adolescent psychiatrist, a specialist in mental health, and I'm pleased to say that due to the efforts, the Herculean efforts of people like Dr. McDonald, Dr. Henry, and this government, I have not lost a single young patient to COVID-19 during the duration of this pandemic, but I have lost patients to overdoses. And in fact, during this pandemic, my daughter, 7 years old at the time, personally witnessed a fellow human being overdosing and being resuscitated. This crisis touches and affects us all. Doctors of BC's policy statement on the drug overdose crisis from earlier this year encourages efforts to separate people from the toxic, illicit drug supply, prevent unintentional toxic drug poisoning and overdoses, improve access to safer pharmaceutical alternatives, as well as improve access to a range of community-based, culturally appropriate, evidence-informed substance use prevention, harm reduction, treatment programs, and services. This ongoing crisis has had lasting detrimental impacts on people who use drugs, their families, communities, our first responders, healthcare providers, and the healthcare system. These actions, which we speak of today, are urgently needed. Thank you, Minister, Dr. Henry, and Dr. McDonald.
Thank you, Dr. CHOW, Dr. McDonald, Dr. Henry, and everybody who has worked to build this expansion of our prescribed safer supply policy being released today. Thank you all for sharing and joining in this announcement to share your insights about what this expanded policy will mean for British Columbians.